I bought a cold plunge tank. That's at my house for me to try. I'm trying to figure out whether it would work here or not. Cold plunging is very popular right now for a lot of reasons, at helping the body get through aging and to recover faster from illness. And that might come here in the future. A lot of work being done now on red light therapy, infrared. I have one of those at my house that I'm trying to figure out whether I'm gonna bring here or not. So I do experiment with a lot of things, but most of the stuff makes sense to me, and I think it makes sense to my patients because it's all related. If we're doing prolotherapy on someone's back or neck, back in particular, there's a very common spine condition called lethesis. So it just means that the bones in the spine have shifted, and there are grades of that. A lot of people have a low grade of lethesis. It's called grade 1, but when you start getting lethesis, the bones shift. And so that can cause symptoms of sciatica, can cause back pain, can cause hip pain, neck pain. A lot of the things that we're doing with prolotherapy is to try to stop that lethesis or control it. The surgical answer for lethesis is a fusion. And so that's metal hardware going in the back. It can be very helpful for people, but we're doing less of it these days because once you fuse two bones together, you set in motion something called adjacent level disease, adjacent segment disease. It just means that the levels above and below the fusion are going to have to work harder to bend to let you have your motion, whatever way that's going to be. And then those levels get under more stress. And if you live long enough, then those levels get fused. So the fusion just gets marched up or down the back as you go. And we don't want the body to start losing its mechanical advantage. And so when we start looking at this, for example, we're doing these things to strengthen ligaments in the back and these attachments to stabilize the pelvis, to stabilize the back, to stabilize the backbones, stabilize the hip. But a big part of that is your muscular system. And prolotherapy with PRP and HGH, as successful as it is, and as much as I love doing it, and as much as it's helped people, it doesn't address the muscles. And so we brought in the M-Suite program. It's M-Sculpt Neo and Mcella. These are two machines that use high-FEM technology, which is high-intensity focused electromagnetic therapy that strengthens muscles. It contracts muscles. And so if we can do that in conjunction with the prolotherapy procedures, then you can start strengthening the core muscles. And that will stabilize the pelvis. It will stabilize the belly to then help the lower back out. You can use the Mcella machine to strengthen the pelvic floor muscles. That's very important. Your pelvis is two pieces. It's connected in the center and in the back. And so those pieces flex back and forth. They have to, for instance, in a woman who's delivering a baby, they have to separate, let the baby come out. And so there's all this motion there. And so the ligaments are very important, but they're not going to address the muscles. These machines can address the muscles. Again, it's sort of realizing the bigger picture is let's not focus on one thing. Let's try to do a lot of things together to improve someone's life and improve function.